U.S. President Donald Trump has declared a national emergency, but as recently as Sunday, he was urging the American people to relax. What is the true state of affairs in the U.S.? And the British government is facing criticism over a controversial strategy for fighting COVID-19. What is herd immunity, and how is that supposed to work? Welcome to The Point. Coming to you live from Beijing, I'm Wang, sitting in for Liu Xin. Extraordinary measures for extraordinary times. Across the U.S., emergency measures are now in place to combat coronavirus. Schools, bars, stores, and restaurants have been shut down in many cities, and mass gatherings banned. A curfew was enforced in a city in New Jersey. This comes after U.S. President Donald Trump on Friday declared a national emergency and released up to $50 billion to fight the virus. Will these measures work, and work fast enough? I'm now joined from Washington, D.C. by Eric Ding. Dr. Ding is an epidemiologist and health economist at the Harvard Chan School of Public Health. I'm also joined via Skype by Mr. Wang Huiyao, president of the think tank Center for China and Globalization in Beijing. Welcome, gentlemen. As we speak, let's begin with the economic impact. As we speak, the U.S. stock market has just opened. I'm looking at the major indexes. Dow down by 9.7%, NASDAQ down by 6%, and S&P 500 down by 8%. This despite the U.S. Federal Reserve's rate cut and despite the injection of $700 billion into the U.S. market. Mr. Wang, I want to go to you. It looks like the Fed's measures have not allayed investor fears over the coronavirus. Your quick thoughts.
Absolutely. I think that, as a matter of fact, we have, since last financial crisis, 2008, there's already 12 years, there's already a correction is due. But as a matter of fact, with this coronavirus, we have seen the massive slowing down of the economy, and also the cutoff of the communications and the flights, and also slowing down of the industrial output. Most of all, the panic. So I think on top of those, we are likely going to see probably a recession, or even this going to land into an economic crisis. So continuously, the stock coming down, stock crash, it's really symbolized that we are not that far from economic recession, and then that's really send alarm to all of the world now. I think we have to be really watch out for that.
So, Mr. Chen, as a health economist, how do you look at the impact of the coronavirus on the U.S. market? Because many of my friends in the U.S. are comparing this downturn to the financial crisis in 2008, and they point out that the Fed, its drastic measures this time around resembles the measures in 2008, except that the Fed this time around rolled out drastic measures over just one weekend, whereas the previous measure a decade ago was rolled out over 16 months. Eric, can you hear me?
Yes.
Yeah.
In terms of the, yes. Can you repeat the question? I didn't come through.
So basically, your assessment on the impact of the coronavirus on U.S. market, as we are looking right now, major indexes
really
down.
Bad. Yeah, the major index is down, and more importantly, I just noticed that they suspended trading again for the third time in 2 weeks, and that is really bad. The epidemic, and I've been saying this for weeks, people have not adequately appreciated that the market is not fully understanding the drastic depths of this epidemic. This epidemic, some people think it will end in like 1 week, 2 weeks. They are wrong. This epidemic will not stop. Even when summer comes, it will slow down, but it will not stop until we have a vaccine. And this is what the market is finally reacting to.
So, Eric, do you think this is more of a short-term reaction to the coronavirus and this current outbreak in the U.S. and indeed around the world? Or is this caused more by the economic fundamentals in the U.S.?
No, I think this is because the economic fundamentals are still decent. Productivity and jobs and unemployment numbers are all pretty okay. The major issue is that it's like a black swan, as we say. This caught everyone by surprise, and especially it was downplayed for the longest time, and people were misled that this is okay as Trump said it's just corona flu, and he was telling people that it's okay to go to work. That's not true at all. And with the suspension of testing for the past 3 weeks, that actually misled people into a false sense of security whenever the virus has actually been doubling, tripling during that time.
Well, Mr. Wang, over 3,000
Yes.
people infected in the U.S. currently, all across the states, across all but one state, actually. The current measures are there, you know, from banning flights from the EU and the UK to advice against gathering of over 50 people. We have seen a curfew in the city in New Jersey and also a partial shutdown in New York. Do you think these measures by the U.S. authorities are enough?
I think it's kind of a little bit slow in reaction. You know, we probably basically lost at least a month, so it's not, if not a month and a half. So since China actually, you know, started this coronavirus, China has taken swift and drastic actions. For example, China has locked down Wuhan. China has stopped people gathering and social distance, and also China has actually, you know, the neighborhood community has actually acted check one by one to get all those suspected cases to send them to the different type of hospital. And China has mobilized and get 2 hospital built in 10 days, and then turned dozens of exhibitions and stadium into temporary hospital. So I think U.S. has to realize that these probably are some of the drastic actions we have to take, and in order to really get this under control. Otherwise, it's going to be really quickly spread, and then it's going to affect everybody, and then we'll probably pay more damages at the end. So a small price probably to pay at the beginning, but or even a relatively large price now. But if we were not, you know, fast enough to combat that, we may have even you know, bigger losses in the end. And also the online infrastructure is there in China. You know, people are communicating and buying online, and the delivery and the supply chain. You know, also the government coordination that, you know, sending 60,000 medical staff from over China to Wuhan, you know, things like that. That kind of mobility is costly, you know, calling for combat this kind of crisis is necessary. I think right now, you know, you have 50 states in the U.S. and everyone act on its own. The federal is just starting to, you know, to pay attention to this. It's probably, you know, not fast enough. And also Western countries, you know, or G7 or G20, we should really get an online meeting right now and discuss how we can combat this collectively, international efforts. And also WHO should call a ministerial meeting of health of all the countries together and really, you know, discuss what are the measures that we can take to combat this crisis.
A meeting of G20 sounds good to me. Dr. Ding, there has been criticism regarding the American government's reaction to the coronavirus. There was an initial lack of preparedness and testing nationwide. Right now, the U.S. federal government said they have set up more drive-through centers to test people, and they are increasing commercial labs' ability to process multiple samples all at once. And President Trump seemed to be changing his tone a little bit too, suggesting that the threat of the virus is real. How do you look at the U.S. government's response right now?
I think American government has been extremely slow, and now they've actually woken up to the reality that they cannot just tuck this under the bed and hopefully it goes away by the next day. So I think it's ramping up. The commercial testing is good, although recently there's also, in addition to test kits, there's been shortages of the reagents, the chemical extraction reagents, in order to first pull out the nucleic acid so you can run the test. That is a shortage that is almost beyond the control because it's manufactured by very few distributors, and there's a worldwide demand that, you know, that government can't just overwhelm come right now. And in addition, the reaction of actually locking down the cities in different states, that is not done at the federal level. That's actually done on the local level by these governors and mayors, and only certain states have woken up and put enough lockdown. CDC finally gave advising to do the 50-person containment, but CDC itself has no laws in which it can enforce. So this is why I think the federal government response has been a little bit late. They're trying to play catch up. Hopefully we didn't lose too much time, but that initial 3 weeks of testing that we missed is worth 8-fold rise in this epidemic that we potentially cannot get back.
Well, Dr. Ding, what would be your advice to our viewers in America and indeed around the world? Because there have been reports of panic buying, long lines at U.S. supermarkets, people are hoarding daily necessities. There has been panic in some parts of America, let's be honest. What would be your advice to them? Dr. Ding.
My advice, first of all, there's no need to panic buy, because panic buy itself solves nothing. Slowly prepare. And second of all, there is no food shortage. Our grocery stores are fully stocked, and if it's empty, it will be restocked the next day. There is no underlying critical shortage of these essential goods like foods and water and things like that. But I think people are waking up now finally to the reality, because they were warned too late by the federal government, that, we have to prepare, and we have to prepare for lockdowns, or at least containment of public gatherings. Now it's that reaction time, and of course there's chaos in the middle of it. But we will get through it because there is no underlying major shortage.
Well, President Wang, I want to go to you. As of today, March 16th, there are now more positive cases outside China than inside. This is pretty amazing, because who would have thought this could be reality even 3-4 weeks ago? But it is the reality now. This certainly got the Chinese authorities on edge again, because Beijing has been fighting this virus, and it looks like it's almost contained, but now they have to guard against imported cases. That's why Beijing is enforcing a 14-day quarantine for all passengers flying into the city, but there has not been a nationwide travel ban for inbound visitors. What, in your opinion, should China do right now to stop people from bringing the virus from overseas to China?
Well, I think that actually a lot of people actually come back as really the cases not well received the treatment, or maybe not even get the chance to test in the U.S. or elsewhere. So I think what we can do is right now really support the world, and then maybe also mobilize the WHO resources to really let test kits available to all the people, patients that want to be tested. For example, the lady who come back to Beijing, who were confirmed the coronavirus, is that she has to go to the U.S. in Boston and traveled a few times. Actually talked to the hospital, went to the hospital a few times, couldn't get a chance to be tested. So I think we should really let the test kits be really available to all the people who want to be tested. Like I saw that Joe Biden was complaining that U.S. is even not taking advice and also the support by WHO, who want to donate testing to the U.S. I think that should be really escalate, speeded up. The second, I think that China should really, working with all the international community, we should have a really international joint efforts to combat this virus, because right now this coronavirus serves up as a wake-up call. It's how silly we are. We are because of the ideological differences. We are fighting with other issues, but now we're really facing the real danger and the threat is from the pandemic, from climate change, from the terrorism or property, what have you. So not really we should fight on the ideological front, and also maybe conspiracy theories and things like that. We really should concentrate on how we can save lives and limit the spread of the disease, and then really control the situation. So finally, I think the world leaders really, and also world health ministers should really get together to really see how we can have a joint plan to contain this virus and international coordinated efforts. But also we have to, every country, IMF, World Bank should really all come together, United Nations, stimulate packages for the world. Because if we contain the virus maybe by the later time, when the world economies collapse, that is also no good. That could even cause more casualties and more damages to not only to the human life, but also to the society and the world economy at large.
Right. So, Dr. Ding, what would be your advice for China and the Chinese authorities to curb the cross-border spread of the virus, mainly by how can they stop the cases from being brought by overseas visitors to China?
Yeah, I think first of all we need to develop a rapid test, because airport screenings just for a fever and temperature on your forehead is not effective. We know that it misses basically 4 out of 5 cases if you just screen by temperature alone. What we need is rapid on-the-spot testing as quick as a glucose meter. That way, we can still have our economic productivity without fully shutting down the border. Because shutting down the border causes a lot of strife. And again, I think having pre-screening before people get on the plane is also a really good idea as well. I think that we have the technology to do it. We just need to implement them and lift the bureaucratic paperwork so that these tests can go into play right away.
All right, gentlemen, thank you so much for your analysis. Thank you again to my guests, Eric Ding, Dr. Ding from Harvard University, and President Wang Huiyao from China, from think tank China and Globalization. Thank you so much. And we'll come back to talk about the UK's plan for containing COVID-19 because it is under intense scrutiny. What is herd immunity and how is that supposed to work? Stay with us.